right, I've got the official Apple time chiming in my ear saying 9 o'clock. So welcome everyone. Thanks for joining us this evening. We're going to talk how to pay down student loan debt, managing your debt like a professional. I'm your host and your moderator for this evening. My name is Rich Groves, and I've got a great speaker here for you this evening, Dr. Ashley Keene, who joins us from Florida. I'm going to introduce Dr. Keene in just a little bit, but just as we're getting underway, let me thank our sponsors for this evening, Aspen Dental, for providing us with an educational grant that enables us to bring together a great program, a fantastic speaker, and an opportunity to talk as professionals and colleagues tonight. As I mentioned, my name is Rich, and I'll be happy to handle all of the questions and things that you'd like to pose to Dr. Keene at the end of the presentation. She's going to speak for about 40 minutes and talk a little about something that's very important to all of you, that's student loan debt, and some insight that can help you as you're thinking about your transition into the profession, and some advice that she can give you that you can start applying now even while you're still in school. You can use the chat function or the Q&A function to submit those questions to me, and we'll queue them up for Dr. Keene at just about 40 minutes from now. In the meantime, I'm just going to give you a last minute to check your audio levels, and I'm going to introduce her in just one moment. But in the meantime, just say thank you for making the time tonight. We'd like you to finish off your evening once we close the presentation by just taking 2 minutes to complete the post-event survey so that we can use that for planning our future sessions and understand how we can continue to bring you great information like we are tonight, courtesy of Dr. Keene. Dr. Ashley Keene graduated in 2013 from LSU School of Dentistry, so she was in your shoes very recently and started that same year as an associate dentist working in South Florida. In 2016, she became a partner of Dr. Dustin Dixon in an Aspen Dental practice in Florida, and she's going to tell you a little about her experience as a student and her transition into dentistry, and just some recommendation that might help you as you're tackling this important issue of student loan debt. And so without any further ado, it's my pleasure to introduce you to our speaker this evening, Dr. Ashley Keene.
Hi, good evening, and thank you for that introduction. So like Rich said, I'm Dr. Ashley Keene, and we're here tonight to talk about how to pay down student loan debt. Now, I'm by no means, a financial planner or anything like that, but I'm just here to give you some insight on what I've learned over the past few years and some things that have worked for me. So a little bit about myself. I graduated from LSU in 2013 from dental school, but even more importantly than that, before that I was an undergraduate at University of Miami, so go Canes, had to get that one in there. I started with Aspen Dental right out of dental school in 2013 here in Southwest Florida. I worked with Dr. Dixon, and I was hired originally to be an associate dentist. But by the time I got my license, there was an opportunity to be a managing clinical director. So I was basically a sole practitioner right out of the gate from dental school. From there, I learned a lot and grew a lot and realized that the best decision for me was to partner with Dr. Dixon at Aspen Dental, and I did so in 2016. Since then, I've become a mentor for Aspen Dental in Florida and even for some other states, and was recognized this year at our leadership retreat as Aspen Dental's Mentor of the Year. I participate in our Healthy Mouth movement every year, which provides dental care to our area's veterans. And I also just recently completed my fellowship in the International Congress of Oral Implantologists this last February. So a little bit about what we will be doing tonight is we're going to be talking about student loans, which is a touchy subject for a lot of people. But basically, we want to know about our repayment options with student loans, including loan consolidation, refinancing, repayment programs, and income-based repayment programs. Different ways to manage our debt as we come out of dental school and think about buying practices and buying homes, what compounding interest is, and the pros and cons of consolidating loans. We'll talk a little bit about the importance of timeliness and documentation with keeping track of our lenders and payments and things like that, as well as the implications if we're unable to make payments, so deferment and forbearances on those student loans. Also talk about some techniques that financially stable and independent dentists use in different ways that they're able to manage their debt, as well as talk about some pending legislation that may impact borrowing in the future. I'll also touch on at the very end a little bit about how ADMI or Aspen Dental does their compensation program and how that can help you with your student loans. So why I joined Aspen Dental or DSO supported practice, honestly, right out of dental school, I just wanted a job. And I knew I had a lot of loans, and I knew I had dedicated 8 years of my life and blood, sweat, and tears to a profession, and I wanted to do dentistry. I was drawn to the guaranteed income. I was drawn to the support and mentorship that DSO provided, Aspen Dental in particular. And I knew that I was going to get to do a lot of dentistry, and I was going to get to continue to learn, and that was important to me because I know there was a lot in dental school that we didn't learn, especially on the business side. When I first started, I thought it would be a year or two commitment to Aspen Dental, and then I would move on to whatever I decided, whether that be private practice or buying my own practice or working with another dentist. But as I started working, I realized that the model worked for me, and it was something that I really enjoyed and that I loved, and so I wouldn't change my career path for anything. So we can talk about that if you guys have questions about that in a little bit as well. So student loans, it's something that nobody likes to talk about, no one likes to think about, especially as you're finishing up dental school and you're thinking about boards and getting your license and finding that perfect DO for your boards patient. But student loans are there, and our student loan debt's not going away. When I graduated in 2013, I had loans from dental school and from undergraduate. So I had over $100,000 in student loans. It's a scary thought, but the thing is you're not alone. There's a lot of doctors out there with just as much, if not more, and it's something that we all talk about. So it's not something to be embarrassed about. It's actually some kind of messed up competition that dentists like to have, see how much student loans we all have. So at this point, we're going to take a quick poll and kind of see where everyone's student loans are. There we go. So over on the side, you should see the poll, and it will talk about your student loans, and it's a true or false question. So if everyone just wants to take some time and answer that. All right, so Rich is saying about 2 more minutes. We're going to leave that open for everyone to answer. This audio is frozen. Okay, so we can see here that quite a lot of people have quite a bit of student loan debt. So 67% are going to have more than that $261,000 in student loans, which is the vast majority. Okay. So what are the impacts of this debt that we are incurring in order to become dentists and to take on our dreams of helping patients basically get the care that they need? Well, basically, there's a lot of professional and personal impacts of this debt. Students that take on student loans are less likely to specialize and enter private practice, and they're more likely to practice long hours because they know that they have to pay this money back somehow. It can limit how you're able to buy a home, buy a car, or just take on any life's challenges that you may face. Unfortunately, it's no longer a time when our dental school professors went to school where they had lower tuition and significantly lower interest rates. Most of us don't have the luxury of working part-time or cutting back our hours. We have to work. We have to pay off these student loans. And it's something that we can't walk away from. Was a little bit staggering to me when I read this information, but out of 72,000 bankruptcy cases in 2008, only 29 of those cases were discharged the student loans if they were defaulted on their student loans. So it doesn't go away, and we are expected to pay this money back, and so we have to figure out how to do that somehow. There's also health effects to student loan debt. For me, I remember when I was first graduating, money was my biggest stressor. You don't think about coming out and not being able to start work right away and, waiting for a dental license. And there's things that come up in life that you just have to kind of roll with. I remember going to the grocery store and just being anxious and having anxiety picking out groceries and going through lines to buy groceries, something that we need, food every day. So there's stress and can increase your blood pressure and affect your health as well. But one thing I can say is just keep calm, take some deep breaths. If I can handle it, all of you can. I'm by no means a person that enjoys dealing with finances, but it is possible, and you're going to be able to handle this and gain control of it. One of the ways that I was able to get control of my student loan debt was through debt consolidation. So that's basically where they take all of your individual student loans and combine them into one large loan where you'll have one monthly payment. I'm sure a lot of you haven't done this yet, but when you graduate, you'll be able to log into Sallie Mae or Nellie Mae or whomever your lender is, and all of your student loans will be listed there. I had a lot of them, and they were all listed, and it was kind of overwhelming to figure out which ones I wanted to pay off first, the interest rates and so on and so forth. So having them all in one location and one monthly payment made a much easier way of handling it for me. It also will help you get lower interest rates, and it can either be in a secure loan or an unsecure loan, and that is something that depends on the lender and also depends on your credit score and your own personal situation. Secure loans have lower interest rates, but it places your assets at risk if you're unable to pay that loan. And then unsecured loans protect your assets, but they're much harder to qualify for. So I talked a little bit about this, your credit score. Whenever you're trying to take out a line of credit, whether it's for a home or for a practice or for student loans, anything that you're taking out a line of credit money for, there's 5 things that a credit score is calculated by. And one of those things is your capital, which is basically your net worth, and it's determined by the difference between what you own and what you owe. Right out of dental school, a lot of us owed a lot more than we owned. Didn't have, a practice yet or a home yet or anything like that. So our debt is all through student loans. The second thing is capacity, which is the sum of your monthly payments divided by your income. If your capacity is 25% or greater, your lenders are going to look carefully. Now, all of that being said, when they look at student loans, there's things that we'll get into in a little bit about good debt versus bad debt. And student loans are something that will help you increase your earning potential. So it's not all bad. Collateral, however, is something that is basically the value of everything that you own. So you'll use your collateral in order to borrow money from your lenders. The conditions of your credit are personal circumstances that affect your ability to repay. So thinking about, are you going to be able to work full-time? Do you have medical conditions, something like that? And your character is how well you've managed your finances in the past. So every lender that's going to give you a line of credit will look at these things, whether it's for a school loan or to buy a practice. And something that's important to realize is that credit doesn't start when you graduate. It starts when you take out your first line of credit. So you took out a student loan, you now have a credit score. So while you're in dental school, it's important that you pay attention and protect your credit. Don't take out more loans than you need, and make sure that you're making payments on time. Try not to rely too much on credit cards. I know that's hard to do sometimes when you don't have income, but make sure that you're able to pay off what you're spending each month and don't accrue a large amount of credit card debt. Continue to pay things down in a frugal lifestyle as you're finishing up dental school and graduating and becoming a young dentist. And if you're not able to make your payments, make sure that you reach out to your lenders and come up with a solution so that it's not negatively affecting your credit score. Remember that what you're buying on your student loan money is actually, you're going to be paying that back with interest. So you don't want to be spending lavishly when you're in dental school and then have to pay that back and then some. There's good ways now with technology how to monitor your credit score, even daily, monthly. There's some websites that you see up on your screen, but also a lot of banks with their mobile banking now and credit card companies, you can check on your apps or on your mobile banking, you can check your credit score almost daily. So we talked a little bit about interest and paying things back with interest, and this is kind of just an example to bring home how much interest can really affect the amount of money that you end up paying back. So for a 10% interest loan, $100 in debt will grow to $400 and then eventually to $1,700 that you will end up paying back before you end up closing out that line of credit. So the moral of the story is just to prioritize your spending and pay down the loans with the higher interest rates first. So how do we pay back loans? So there are different repayment programs that you'll be faced with as you graduate and your loans finish their grace period. The standard for most student loans is a 10-year program where you'll pay less overall because you're paying for a shorter amount of time. So for example, a mortgage is usually 30 years. Student loans usually is a 10-year program. Sometimes the standard repayment option has fees that are a little bit too much for us right out of dental school, so they do have some other options. There's a graduated program where it doesn't extend your loan term. It leaves you still in a 10-year program, but your initial payments will start out lower and then gradually increase every 2 years. When I first graduated from dental school, I utilized this, and I'll explain that in a minute. There's also the extended loan programs where you'll extend the length of your loan over time. So it will lower your payments currently, but you'll end up spending more because you're going to be spending more on interest over the length of the loan. Income-based repayment is another really good option for newer graduates as well as those who are going into a residency program. This is where they'll base what you owe back off of what you're making, your income. So it's exactly as it sounds, your income-based repayment. So here's where I was going to go into this a little bit more. When I first graduated, I went into an income-based repayment program for the first probably 6 months to a year. So my payments were significantly lower than they would have been for a traditional 10-year standard repayment. From there, I was able to convert that to a graduated payment, and my monthly payments increased, and then ultimately I was able to refinance. I made the decision to refinance a little bit later than some other dentists that I know, and that was just a personal decision, which I, again, will explain in a little bit based on some of the forbearance options that are offered with federal loans versus private loans. The last repayment option is a pay-as-you-go, which is basically the same thing as income-based repayment, except the monthly payments are lower, and the qualification for this type of loan is much harder to get. We talked about this a little bit already. It's common to have multiple lenders for multiple loans if you haven't refinanced. So you'll able to log in to the student loan data system and check your status of your loans, as well as all the lenders, document your conversations. It's important to realize that if you fail to respond to a delinquency notice from a loan service, even if you didn't know you had that loan, it puts you at risk of becoming delinquent and going into default. And this will negatively affect your credit rating, and it also makes just everyday tasks that you'll need to do as you're starting as a new dentist very difficult, such as starting a utilities bill or a cell phone plan, obtaining homeowners insurance or renting a home. And on top of that, buying a practice, a house, a car, anything like that would become much more difficult. So as we start talking about getting into our loans once the grace period is over, it's important to know how long that grace period is. I know for me, most of mine were 6 months. So by the time I graduated dental school, that gave me a little bit of time to start working and get things situated. If you're unable to find a job, work with your loan companies and your lenders to seek deferment or forbearance, and we'll talk about the difference between what those are in just a minute. If you are making a pretty good income and you have the ability to make a payment higher than what your minimum payment is, make sure you're paying towards your principal and you're able to decrease the amount of money that you're spending over time. Keep records. I started a spreadsheet that had all of my loans just to keep everything organized, and it would have the amounts that were due every month and when they were due, and I would put the confirmation numbers when I would pay them. Some companies will give you automatic interest rate reductions if you do automatic payments. The other nice thing about automatic payments is then you don't have to worry about forgetting to pay the bill. So this is kind of what I touched on earlier about different types of debt. So we have good debt and bad debt. The nice thing is that educational debt is considered one of those good things. You're investing in your professional development. It's going to significantly multiply your earning capability over your future. I'll tell you from my experience, yes, I had over $400,000 in student loans, but it didn't, because I made my payments on time and I kept my credit score well, it didn't affect me being able to do all the things that I needed to in life, such as buying my practice and buying a home, buying a car, things like that. So if you manage it well, educational debt is not going to drown you as long as you're paying it off over time. Practice ownership is another type of debt that is something that's investing in your own future. So this is when you're trying to open your own business, whether it's buying a practice or partnering on a practice. Most new graduates can actually produce far more revenue in dentistry by the end of their first year than it's necessary to support that practice. So they're able to pay all their bills, their debt payments, and still have more money left over than they would have earned as an associate. So that's something important to keep in mind. It's scary to take on another huge loan when you have student loans, but the earning potential is there when you're owning your own practice. The longer that your ownership is delayed, the more money that you're losing because you're losing the profit as a practice owner versus being an employee. Home ownership is another type of debt, pretty straightforward. That's when you're buying a house. It's recommended that you do this after you become a practice owner because this is not one of those things that they consider good debt. It's for the purpose of, can impact your compounding interest and things like that. So you want to make sure that if you are buying your first home, it's affordable and you can make the payments as well as the payments for your practice and the payments for your student loans. So budgeting. I don't know many people who like to budget, but I'm not one of them. I'm not very good at it because I like to shop, but it's doable and it's unfortunately a necessary part of life. Just when you think, all of your big purchases are out of the way, you've bought your home, you've bought your practice, you have the car that you want, there's always something that comes up, so living on a budget is very important. So I'm going to give you a little bit about what was on my budget when I first graduated from dental school. It's pretty simple. It's basically what it took to live. So my husband and I moved back to Florida from New Orleans with pretty much nothing, so we had to start from scratch. We lived with my parents for a few months to save money. we were functioning on one vehicle that was already paid off to save money as well. And we were kind of just building up that base for us to be able to purchase a home, purchase my practice. We were not spending on huge vacations or $2,000 meals out at fancy restaurants. We were, you know, budgeting our resources, saving as much as we could, putting into our retirement plans, and trying to be responsible for those. You know, groceries, utilities, that type of thing. So not big spenders when we first graduated from school. So things to do, kind of what we just said, limit your spending. Spend according to the things that are going to help you become more profitable. So spend money on your practice, spend money on supplies for your practice, on continuing education courses that are going to help you bring in different types of procedures into your practice. Big thing that I am a huge proponent for is to surround yourself with people that are smarter than you in different areas. So you want to be surrounded by people who are experts in their field. Find a financial planner who will be able to help you make the right decisions and timing of the purchases that you're going to make. Buy your practice before you buy real estate, again, because of the way it affects your debt-to-income ratios. And prepay on your student loans and credit cards that are affecting your credit worthiness. So a huge student loan is not going to affect how a lender will look at you as much as a huge credit card debt will. Something that I was told when I started getting into, you know, buying my practice was that lenders love to give dentists loans, if that makes you feel any better, because dentists will pay it back. We're notorious for being able to make the payments, and, you know, as long as we're spending smartly, it's something that they're going to help you with. Something that you don't want to do is you don't want to spend extravagantly on things that are not going to help increase your income potential. So cars, houses, vacations, expensive restaurants. You want to pay on your loans, get them paid down, and make smart decisions. So how do we organize all of this? Again, I really highly recommend starting some sort of spreadsheet that will keep track of all of your loans, your interest rates, your terms, your expenses, and help you keep it in an organized fashion. Make lists, make a budget. There's a lot of programs out there that can help you make budgets. Excel has a program, there's tons of them online. And pay off your loans that have higher interest rates first. So you want to pay off the loan that has a 10 or a 12% interest rate before the one that has a 2 or a 3. If you're unable to pay on your student loans, there's a couple of things that lenders will do for you when deferment versus a forbearance. And basically the difference is whether or not the loan will accrue interest during the period of time that you're not paying on it. Deferment allows you to put off the loan while you're pretty much still in school. So if you're going to a residency program or something like that, you can defer your loan. If you, for whatever reason, are unable to pay payments due to a financial strain or a lack of employment, that is forbearance. And unfortunately, during forbearance, you will continue to accrue interest on those loans during that time period. This was one of the main reasons that I waited to refinance my student loans right away. I wanted to make sure and be certain that I was in the financial situation to make a large monthly student loan payment. And right out of dental school, I just wasn't confident in that. I didn't know what my salary was going to look like. So I knew that federal loans are more likely to offer forbearances than a private loan would. So I waited until I was 100% certain that I would be able to make that payment every single month before I refinanced. So that's something just to keep in mind. That was my personal decision. I know other dentists who refinanced right away to lower their interest rates right away. I just wasn't so much of a gambler, I guess is the best way to talk about it. So speaking of other dentists, you know, what are things that dentists do? The nice thing about being a dentist is you've got to have some sort of type A personality in there to be in this profession. So we're data driven. We like spreadsheets. We like documents. We like research, things like that. So, you know, think long term, look at things from different perspectives. get a financial planner, and make the decision that works best for you and your family. A little bit about Aspen, and one of the nice things about working for them is that they have reports and spreadsheets for anything that you can imagine. So it helped for me to itemize, and I would know what my paycheck was going to look like every month, and I would know exactly how much I was going to get paid before I needed to pay out my bills and my student loans. And it let me know if I would have the wiggle room that I needed or wanted to go out to a nice dinner, to buy the new cell phone, or whatever it is that I was wanting at the time. This is just an example of if you have a limited amount of money to pay each month towards student loans, how to kind of do that up to different loans. So you can see that a 12% interest rate versus a 10, a 9, and a 7. So you want to hit the loans harder that have the higher interest rates. It'll help you pay them off quicker and for less money. Good thing to know is that you're not alone in the field. You know, you have other dentists supporting you, but you also have the ADA supporting you. They're making strides to work with Congress for lowering interest rates on student loans. They're advocating in our behalf for tax and refinancing and deferment periods. You know, they've made big strides in changing the way the national boards and the state boards have been working. So this is something else that they're working on. And that's why it's important to be part of your dental societies wherever you live, because they are working on your behalf every day. All this being said, it's a very stressful subject, and it's something that not a lot of people like to think about, especially before graduation, even right after graduation. But just know you're going to find a job, you're going to have the means to pay off these student loans, and just have confidence in yourself and know that you chose the right profession and the right career, and it's going to work out. This is a good point for me to go into a little bit about Aspen Dental's pay structure and how that made me a little bit more comfortable. Like I said, you had a guaranteed income. So one thing with Aspen Dental is you have a guaranteed daily rate that you will make every single day, no matter what you do in the practice, no matter if you're doing nothing all day or if you are doing full mouth extractions all day, you get a daily rate. On top of that, you're incentivized monthly based off of what the entire office will produce. So the difference there compared to other places that I've looked at is that it's entire office. So it's not just what you're producing, it's what hygiene and specialty and any other doctor in the office is producing. That was big for me because that meant to me I wasn't going to be sitting in the back of the office just doing fillings and molar root canals all day. It makes sense for me to grow my associates now in the position that I'm in, for them to do the big cases as well. Because if they're doing big cases and I'm doing big cases and the office is doing more revenue, we're both going to make more money. So basically how it works is they take your average of the office production and deposit for the month. From that, all of the financials are subtracted. So all your expenses are subtracted. Supplies and all the things that you can't control, the electric bill, things like that, and then also salaries of the other staff. And at the end, you're left with your center gross profit for the month. From there, an associate dentist makes 8 to 10% of that. A managing clinical director will make 16 to 20% of that. So, for example, let's say that the managing clinical director was due to be paid $20,000 for the month. Well, you don't get a check for $20,000, unfortunately. What they do is they subtract what you've already been paid. So say you've already made $10,000 in your daily rate. So $20,000 minus the $10,000, you'll get an incentive check for the $10,000 difference. So you'll always make the minimum daily draw, but there's always a chance, and ever since I've worked there, I've always made an extra incentive every single month. So kind of to summarize what we talked about, be sure that you are acquiring your assets and debt in the correct order, and make sure you're paying them off in the correct order as well. Keep your credit healthy, make sure you're making payments on time, keep track of things, try to keep things organized. get a practice, whether you're partnering, you're buying, you're working with a DSO and partnering with them, get some ownership in what you're doing every day. And other assets and debt that are necessary to acquire over time, those should come second. Invest in yourself, invest in your future, and let everything else fall into place from there. There's some resources that can kind of help you as you start this journey on paying back your student loans and becoming a dentist. Some good resources for you to look into. So now I'd like to open it up for any questions and discussion at this point.
All right,
I'll let it go from there.
Dr. Keene, you can hear me now, yeah?
I can.
All right, that was a really nice job. Really appreciate your insight. That was a fantastic discussion for our guests tonight, and thank you so much for your help when my audio got stuck there. That was really
Oh, you're welcome.
Okay, you have had several questions come in along the way, some of which you've touched on in brief, but I think would be helpful as a rejoinder for some of us. The first question you received was, after school, would it be your recommendation to pay back your student loans, or should you be thinking about buying a practice at that stage?
So for me, I kind of did it all simultaneously, which is not usually recommended. I bought into my practice, refinanced my student loans, bought a house kind of all simultaneously, which was quite stressful, so don't recommend doing it that way. I would recommend buying your practice first. It's going to increase your earning potential and help you pay back those student loans even faster. You know, refinancing them is, again, a very personal decision because of the forbearance options with federal versus private loans. So as soon as you're comfortable knowing that you have that ability, I would highly recommend doing that as well.
Fantastic. That brings us to that next question. And if you had to think about what's the right time to refinance, what was right for you? What might be right for a student who's weighing that decision for the first time?
For me, it was watching my income. So we talked about how Aspen, their pay structure is. Once I knew what I needed to do in the office every day in order for my incentive checks to be at a certain amount, then I was comfortable to refinance. I wanted to make sure that pretty much my incentive checks would be able to cover the student loan that I was paying. So for me, it took about 1.5 years after I graduated, I refinanced.
Fantastic. And so you sort of had the opportunity open itself in front of you, and then you had to make a decision based on that. That sounds like smart play all around.
Exactly.
Do you have awareness of, does deferment or forbearance have an effect on your credit score?
It should not, from my understanding. Now, don't quote me on that. I would absolutely ask your lender. But the fact that they grant you deferment or forbearance prevents them from reporting to a credit company, from my understanding. I would absolutely confirm that with your lender, however.
That's fantastic. Switching gears just a little bit, you were talking about basing your choices based on understanding the salary that you would be collecting and your daily wages. How do you know when you're in dental school and you're seeing a certain number of patients in clinic every day, how do you know how much you can produce and start to make that type of projection into your future after graduation?
So it's really hard because everybody is so different. My personality is I don't like to sit still, and I get very bored very easily. So I knew that I was going to be a go, go, go type of person, and I was going to be seeing a lot of patients every day. Now, that's not for everybody. Some people are going to see much fewer patients a day. I was blessed to have a good mentor in dental school that I was able to, kind of bounce the ideas off of what chair time. So basically, each hour in your chair, you should be able to produce a certain amount of money, and then that will convert to how much you'll be being paid. Right out of school, don't expect it to be perfect right off the bat. It takes several months for you to get comfortable and get into your groove. But, doing a full mouth extraction case for me takes about an hour, and that can be an $8,000 to $12,000 case. So you have to learn what you're good at and schedule effectively. and be realistic too. Don't put so much stress on yourself to do that right out of school.
Speaking of when you're right out of school, do you think from your perspective and what you know from your peers and other professionals, is it a good approach to pay down your debt aggressively in the beginning? And kind of a corollary to that is, how likely is the government's loan forgiveness program as you think about what that might be 20, 25 years in the future?
Well, as for the government, I could not give you any insight on that one.
What?
I would hope that would be a positive route, but unfortunately, your guess is as good as mine on that. As for paying down your loan aggressively, that's really a very personal decision. Depends on where you're at in life. For me, my husband and I were starting our life from scratch. We didn't have the money to pay so aggressively right at first. We needed to get a car and a home and all these other things that you need, furniture and groceries. So I wasn't able to pay aggressively at first as I am now. So for me, I had to wait a little bit longer. But if you're in the situation where you have all of your necessities and you don't have a lot of bills, I would absolutely start paying on them aggressively. However, something I didn't talk about is you want to make sure that you're set up for success in the future too. One thing that I did right away was got disability insurance and life insurance, so that if something were to happen, I was set up for my family to not have to incur all that debt that I had.
That's great. That's great. And this next question, I have a feeling I know how you're going to reply to it, but one of our attendees is asking, of the income-based repayment plans, is there a recommendation that you have for our soon-to-be graduates?
Of the 5 options, again, it really depends on where you are. If you're able to stay on the traditional route until you refinance and get your interest rates lower, then I would say go with that. One thing I don't recommend doing is extending your loan term to 30 years. If any of you have bought a house or are going to buy a house, one of the scariest documents they make you sign is they put out a paper, a spreadsheet, that shows your loan that you're taking out on that day and versus what you will have paid at the end of your 30-year loan term. And to see the difference in that number is gut-wrenching. So something you don't want to do is do that to your student loans. Income-based versus graduated, you're splitting hairs at that point. And also, it depends on your lender. Not all lenders are going to give you all of those options.
Indeed, indeed. Nice response. Thank you very much. I've got a question here from the standpoint of filing your taxes. We're coming up on year end and some of those considerations for all of us. Student loans, do paying the student loans affect your tax return? Were you able to claim that at the time of when you were a recent graduate?
No, unfortunately. Unfortunately, with the amount of money that we are paying back, they do offer tax breaks for student loan interest, but it's only up to a certain amount. And the amounts that we're paying back is way over that amount. So it doesn't really give you much of a tax break, unfortunately.
Right, particularly given some of the responses we saw in our live poll tonight, that seems like many of our guests have that similar deep threshold that you've witnessed and experienced firsthand too.
Yeah.
Can you just briefly touch again on the difference between refinancing versus consolidation?
It's pretty much the same thing. Consolidation, you are taking all the loans into one larger loan, whereas, it's pretty much the same thing with refinancing. I guess with consolidation, your interest rates may or may not change, depends on the company that you're using. Refinancing, usually the goal is to bring down your interest rate.
Perfect. Just as an aside, when you thought about your student loans and the type of practice that you were entering as a young associate, did it matter to you what type of payer mix was in the practice, whether it was a cash-based practice, insurance-based, Medicaid, et cetera? Did that have any thought on your loans and what you were trying to achieve with your goals?
Honestly, no. I didn't even actually ever think about that. Now I would think about it more so after having learned as much as I have about the business side of dentistry, which you don't really learn in dental school. But with Aspen in general, you don't really have to worry about that too much. They take care of that business side of it. So I knew if I showed up and was doing dentistry, I was going to get paid and be able to pay my student loans. So it never really crossed my mind. Now as a business owner, it does. It's a little bit different of a perspective.
For sure. And from the when you evaluate your position today and your long-term financial goals, how does that? Do you have a target date for your own student loan debt?
I should be done with my student loans. I believe we talked about this the other day, Rich, within the next 3.5 to 4 years.
Fantastic.
So pretty much 8 years out of graduation, I should be finished.
That's fantastic. Tell us what your typical schedule looks like. You referenced, having a full mouth extraction case, and how has that changed when you were an associate and you were very, trying to work on your hand skills, your confidence with patients, and you had your student loans. Has your schedule changed from when you were first in practice versus where you are now?
I've just become more efficient. I schedule more efficiently, don't waste as much time, and utilize my assistants a lot. You're only as strong as your team, which is a totally different discussion, but your team makes or breaks you. So having a good staff and a good team around you makes a big difference. But, I've gotten faster, just my hand skills have gotten faster, and I figured out, what works for me. But my typical day is I run 3 columns of schedule, which doesn't mean 3 chairs, it just means 3 columns of schedule. One of those is all of my procedures, which is fillings, crowns, surgeries, extractions, implants, anything, whatever procedures I'm doing for the day. My second column is all new patients, so that's where we're building the practice and growing the practice. And then my third column is what I call overflow, or what Aspen Dental calls overflow, and that's basically all of the extras. So emergency patients, periodic exams, denture steps, impressions, deliveries of dentures, things like that. Adding an associate to the practice, and an associate in my practice will start just running a production or a primary chair, so just doing procedures. As they get comfortable with that and decrease their times and start feeling more confident, then they start jumping in and doing new patients and overflow procedures as well. And eventually, ideally, you have 2 doctors running full schedules each.
Fantastic, and making their way through a full patient and bringing care to a community in need.
Absolutely.
Next question from one of our attendees is, she's graduating this year and said, look, my interest rate pretty high for her dental school loans. Do you have any insight on potential private loan companies? Do you've heard good things, favorable comments from your peers or other brands?
Sure. I used SoFi, which I know is a big name out there. They're advertising a lot. They're becoming a really big company. All of the doctors that I work with that have consolidated or refinanced have also used SoFi. And I know Aspen Dental has partnered with SoFi as well. Their interest rates were a third of what my dental school loan interest rates were. So it was a no-brainer for me.
A third.
Mm-hmm.
Yeah, that's a huge difference.
Yeah.
And can you touch on one more time for us? You briefly explained the day rate and how that's calculated in your practice, okay. And you had also referenced in some ways like a bonus structure. And since there are a lot of misperceptions about that production and so forth in a DSO supported practice, if you could just take one more moment, Ashley, and bring us back to that again, we'd really appreciate it.
Sure. So, I was guilty of this too when I first started. You hear all kinds of horror stories of working for DSO, that they're going to tell you how to practice, and they're going to tell you you have to do so many crowns and so many extractions and so many fillings. I can tell you firsthand that is absolutely not the case. Aspen Dentals are all owned by doctors. They are there to support you and help you and offer tips, but they will absolutely never tell you how to do dentistry. That's your job. You're a dentist. You went to school to do it. Go for it. How you're paid of course, it's a business just like anything else, so it's based off of the productivity of the entire office. So let's say an office did $200,000 in a month. From that, we will subtract, so the entire office, I'm not talking just dentists. So between a hygienist, whatever they're producing, if you have an endodontist or an oral surgeon or anybody else come through, the entire office productivity. From there, they subtract center expenses, so supplies and salaries for your dental assistants and your lab technician, things that you can't control like financing fees and credit card fees, things like that. All of that will get subtracted and you're left with the gross center profit for your office. From there, depending on if you're an associate or an MCD, you get a percentage of whatever that number is. So as an associate, it's 8 to 10%, and that percentage is dictated by patient loyalty score, which is basically a way that Aspen Dental measures how satisfied patients are. It's a survey rating. So 8 to 10% if you're an associate, 16 to 20% if you're an MCD or a managing clinical director. So whatever that number comes out to be, that's what you're due to be paid for the month. So say that was $20,000, you're due to be paid $20,000 for the month of November, for example. You've already been paid your daily rate. So if you worked however many days and you've already been paid $12,000, they'll take the $20,000 that you're due to be paid, subtract the $12,000, and whatever the difference is, that's your bonus or your incentive. They call it profit sharing that you will get. That's paid out monthly. So your daily draw is paid out bi-weekly. You get a check every 2 weeks. Your incentive or your profit sharing is paid out once a month, and it's a month behind. So we're in November now, so we'll be getting paid for October. Is that clear?
Yeah, fantastic. And
Okay.
Originating through the patient and their, it encourages, I'm sure, all of you as providers and caregivers. It does encourage some, focus on the patient and making sure that they're receiving your best effort each and every day.
Mm-hmm. We talk about this all the time with anybody that I'm mentoring or my new associates is do what's right for the patient and everything else will fall into place. The money and the paychecks and all of that will fall into place if you're doing what's right for the patient every single day.
That's fantastic. And just as a follow-up question to your last answer, if you wouldn't mind, Dr. Keene, the daily minimum, is that similar to a quote-unquote draw that I sometimes hear is offered in a DSO-supported practice contract?
Yeah, yes. Essentially, it's your daily draw, your daily minimum. It's, they range. It depends on your region. It depends on the practice that you're in, but I've never heard of one lower than $500 a day.
That's fantastic. I appreciate everybody for sending in your questions. Dr. Keene's been really gracious in answering as many as we can get to this evening. If there are some additional, I'm going to let her finish and work on some of her work-life balance here as we near the top of the next hour and allow her to kind of get a little bit closer to that. But she's been gracious enough to share with you all here her address in Florida, as well as her email address, which I'm sure is more relevant for our guests tonight. If you have any additional questions you'd like to ask Dr. Keene, I'm sure she'll do her best to make her way and address as many as possible. Given that she's not got a crystal ball on what the government will do 25 years from now.
I wish I did. I really wish I did.
We all do. We all do. We understand. All right. Thanks, everyone, for joining us this evening. And really, Dr. Keene, on our collective behalf, we really appreciate you sharing your time and your insight with us. We really enjoyed your presentation and your real great comfort with the material and answering some fantastic questions from our audience tonight.
Well, no problem. Thank you for having me, and I hope everybody got just a little bit of something out of it. So
I'm sure
have a great night, everybody.
Special thanks to our sponsors again at Aspen Dental. And 2 last notes for all of you as attendees. We'd love for you to join us on Monday, December 4th For the fourth part in this series, we're going to talk about some must-do steps, some steps you really have to be thinking about as a new dentist, and we'd encourage you to just stick around for 2 more minutes and answer the post-event survey so we can continue to bring great materials like this to you. But on behalf of Dr. Keene, Aspen Dental, and certainly the next DDS, thanks everyone, and enjoy the rest of your night.